Hi Ruth, can you explain to us what you're doing today with the ACE vet?
Yeah, this cat has come in for neutering. The vet's just spayed her and been called away very quickly to look at a dog that's poorly, so the vets don't actually stop here. So this little cat, they use different anaesthetics over here to at home, so I've been learning all about that.
Yeah.
And she's been spayed and will go back to her owner later on today.
I understand you've got 2 dogs waiting outside, possibly one with parvovirus and another road traffic accident. How many animals are ACE seeing here at the clinic in any one day?
You can never tell how many animals are going to come in, but you know, we've seen at least 5 this morning, and that's only within an hour, so there'll be more animals coming in during the day.
How important is it that the aftercare and the complementary healing work is for these animals before they are released from the hospital?
It's very important the way they do the different treatments. I feel that with cat spays they only do side cat spays rather than central line, basically because the people need to be able to see where the spay's been done, just in case it gets infected or anything like that. They use dissolvable sutures so that the sutures don't have to be removed, and it's just so important that these animals get the loving and care that they need.
So what does ACE Egypt need out here?
ACE has a wish list a mile long. They need the money to be able to buy the drugs out here. They need equipment. They've got very basic equipment out here. They need even basic things like flea treatments that they can't buy here. So, you know, every little penny gets very well spent.
And how is the Healing Animals organisation helping in particular here?
The Healing Animals organisation, with the group that I'm with today, is helping by spending time with the animals, giving them oils, calming them down. These animals are all owned animals and they will go back to their owners as soon as they are well enough. So the little bit of time that we have here is well spent with the animals in-house and also the animals that visit, and very sadly the animals that get put to sleep as well.
And what can we do when we go back to the UK? What ways and means can we raise funds for animals in need here?
Any way you possibly can. Beg, plead, borrow through the Healing Animals organisation, through going to events that we're putting on. Look at the Healing Animals organisation website. There's a list of really good fun things that you can do that you'll enjoy and help the animals with.
Thank you very much, Ruth.
Thank you.
We're working here very hard with Marta here in Small Animal, but can you just explain what is happening here with this pup?
This puppy is about 6 months of age and it came in, it's absolutely covered in ticks, which is why I'm not holding it closely, and it's got a wound on the inside of its leg from a piece of green material that you can see there that has been tied around the leg, which the skin was lacerated by that material and has now grown over it. So we're just going to try and sedate this little one so we can get the green material out, flush it clearly, and then give it some antibiotics. She also has a bit of a high temperature, whether that's from the wound or from the many ticks that she has. I'm not actually sure. If you have a look around here, there's a nice bunch of ticks. And these bunches of ticks are all over her body.
Yes, I can see that. This is very reminiscent of what we see in Sri Lanka. The Healing Animals organisation goes to Sri Lanka to work with vet surgeries, and here we can see a rather enormous tick that is a very well developed adult tick that's really taking its toll, and this is most probably creating a tick fever in this little puppy, and obviously the ticks are feeding off the nutrients and the blood, got a bit of fighting spirit. As we can see, there is a muzzle on there's a gentle muzzle here just while the vets at ACE here, and assisted by Ruth from the Healing Animals organisation, is working on this dear little pup here. This is just one of many animals. How many have we been treating this morning, Ruth, so far?
We've had about 6 in so far, and we still have a few waiting to be seen.
Here we are back with our little puppy. Joe's now from the Healing Animals organisation assisting Ruth in, as you can see, taking off the ticks. Just putting you can see there they are, the insects have to be taken out whole. Joe is an expert in this, and you can see they're all wriggling around here in this pot, and already nearly 15 ticks have been removed from this little chap, and there are plenty more, and here we have, there we go, we've got a load more here, and in the ear canal now, just looking, they've already taken 2 out from here.
Oh, that's a good one.
There we are.
Sorry.
Joe getting excited. This is great. He's pulling them out, and
look at it. Look at its babies there. That's. Oh, I get so excited.
And as we can see, there with its babies, and this dear little puppy is having all its blood sucked from itself from these ticks, these little critters that, if left unnoticed, can cause tick fever. Ultimately Lyme's disease and death. But doing a good job here with this little creature.
Yeah.
Hello, this is Elizabeth White reporting from ACE Egypt, and I have great pleasure to introduce you to Kim Taylor. Hi Kim.
Hi.
How long ago did you set up ACE?
We actually opened in the year 2000.
So almost 12 years now. You've had this wonderful establishment that you've created here in Egypt. Tell us about ACE Egypt.
Well, the first 7.5 years we were in a very small place, a little rented place, but we were very lucky to have a legacy come, and they told us to build the hospital that we wanted. So that's great. So now we've been able to have an education room, paddocks, all the things that we need. It's
fantastic. And this room that we're in here now is an education room. Who do you bring to this room?
The local school children. We have permission from the government to educate between the age of 8 and 12, roughly. And so what it's working is 100 children a day, 4 days a week. We put on a veterinary program so that the vets could learn something while they were here. So we had a wound management conversation really. It was a discussion as well as a lecture.
And I understand that you have vets from all over the world coming to work here with you.
Yes, we do. We have volunteer vets, so all welcome. Look at the website. Yes, so it's great. So we have full 3-time vets, Egyptian, and then that's supplemented by the volunteer vets.
Yeah, I mean, I've had a wonderful opportunity to be here and work here at ACE with you. How important is volunteers?
Oh, amazing, because we can't do it without volunteers. And without you, volunteers, everybody, I mean, the place just wouldn't run. So there's too much work for us to do on our own, and it's a teamwork. Of course it's teamwork. So yes, it's really nice to have volunteers, and they bring so many different aspects of work to the place. And it's nice to have a bunch of different people together. It's a nice working relationship.
I've noticed that here, the team relationship is fantastic. Us all working together, so
You've been good.
Thank you.
Help with that, so.
And what do you need, Kim, to keep this establishment going?
Money. Unfortunately, since we built the place, at the old ACE we had 7 inpatient tables. Now we've got 25 plus paddocks, so we can have at times more than 30 inpatients. And it varies up and down, but a lot of times we are full. And that means that we still had the same money from having 7 inpatients to 30 inpatients. And obviously the bills for the medicines and feed bills, which has tripled this year in Egypt, is just awful. So we're now working with only one.
Now I understand here we have Snowy here attached to your breast,
yes,
I might add. But I understand that you actually treat a number of small animals here.
Yes, we do. We do that because there's nobody else to do it. And although we were set up really for the working animals, there's nobody to treat small animals. We supplement the work that we do for the small animals by vaccinations, that sort of thing, neutering for expats that live here. So they pay, people that can pay do pay, but in general, for the poor people, it's free. So, yeah, it's nice to do the cats and dogs as well, because there's a huge need. If anyone would like to come and set up a small animal charity here, we'd be very grateful.
Well, I think just in the space of a week of working here, I've seen about 38 inpatients coming in that have been cats and dogs. And now it's wonderful to introduce you to Dr. David, who is the head vet here at ACE. Dr. David, I've just made up a sarcoid treatment here with green clay, which is actually from the Aswan Dam. Yeah. And we have put natural ingredients in here. There is bergamot, there is garlic, there is seaweed and carrot seed. This will go as a topical treatment on a sarcoid. Firstly, how important do you believe plants and herbs are to complement?
Actually, I can say by experimental, not by saying only. I use one of the things which I know, like a tea tree oil with ringworm, and they give 70–80% of succeed with me. This is a good trial with me with several cases, and they give a lot of good result. This is why I am looking forward to more knowledge about this herbal and about the oil and remedies, which we can use away from the chemicals.
And how important has it been for the healing animals to support you here at ACE?
It's a good thing because actually it's a good thing to train us how to deal with the massage thing and healing way away from, and all the time we use the chemicals and use injection, and the injection this will be very load on the liver and the kidneys, so we have to find some way else, something else that's different than loading on the liver and the kidneys. So maybe which we can use by massaging and healing, it will save a liver and the kidneys for something we can't use the massage with.
Of course, yes.
Yeah.
Yes. And would you like us to come back?
Yes, sure. Yeah, because myself, I have a good knowledge from you now, more than last year, because this time we have 2 lectures.
Yes.
So we have a concentrated time, and I have knowledge now, and I think I have a lot of things to do again. Okay.
Thank you. Outpatients, and I've just made up with some red clay from the Nile, from a topical treatment here for this beautiful stallion who's got a hematoma on his bottom, and so within this mixture is the red clay, is bergamot, is seaweed, St. John's wort, garlic. Garlic is fantastic to break down any toxins in the hematoma. Also, we have observed that there is a small sarcoid. You come in a bit closer here. There's a sarcoid here on the neck, which we've also treated with this topical treatment here today. And if we just take a look at the red clay from the Aswan Dam, this is red clay, which is wonderful because it draws out and also releases the oils very slowly, because unfortunately we may not see this gentleman again. I have given him a supply to go home with and to apply. Here we have a beautiful grey horse that has been involved in a road traffic accident. Dr. David here is attending to this horse. As we can see, quite a very bad laceration to the right fore here. Dr. David, what is the intended prognosis here? What will you be doing with this?
Prognosis maybe is not so good, so we try to do our best.
Yes.
And the owner, I will discuss him to admit here the animal,
yep.
because some owners refuse to admit,
yep.
especially if here nearby us. And then we will see. I mean, we try to do his first aid now, cleaning the wound, and
yes.
do the bandage, and give him anti-tetanic serum and antibiotics.
Okay, thank you. So we will keep in touch, and this is the owner of the horse at the moment. As Dr. David said, some owners do not want to leave their horses here, and it will be very important to persuade the owner that this horse will need to be admitted to the hospital to have the treatment from the vets here at ACE. And here we have Billy and Hassan here clipping away the debris and the hair to expose the wound, so that then Billy can treat this particular wound. We don't want any hair getting in the way, because it could cause a secondary infection on the pole. And this donkey being very compliant here, wonderful. Almost knowing that something good is being reporting from Luxor. We're here as the Healing Animals organisation, working with ACE, Animal Care Egypt, and we're just on an outreach project around the city. And here we're going to be observing some of the dear horses that need our help. As you can see, this horse is extremely thin. Keep your hands down, Ruth. This horse is extremely thin and has lacerations to the front of the legs. You can see how thin this horse is, and we're here to try and help as many horses and donkeys as possible. I've got somebody else going to buy some food. The problem here in Luxor is that the owner of this horse will not bring this horse into the hospital. It needs immediate attention. You can see it is seeking food. It's trying to find food. So we're just now going to just see if we can offer some of the macerated marigold oil. As you can see, this horse is so keen to eat anything at the moment. So this is a marigold oil, which is some flour with the marigolds infused in it. And this is a culinary macerated oil. I can eat this myself. It's for human consumption. It's like taking olive oil. But at the moment, this is all we have on us. The ACE team have just gone to get some alfalfa for this horse. the hock. You come round to here, Holly, just to show how his ribs, the ribs are showing. You can see the spinal process all the way along the spine, and a very, very thin neck. And here is a member of ACE who is just got some alfalfa. This is fresh alfalfa here in Egypt that we actually have back in the UK for our own horses. And as you can see, this horse is going mad for something to eat. Wonderful sugar plantation, sugar cane here, that is being harvested this time of the year. Well-kept donkeys that you see here that regularly come to ACE for maintenance work, for hoof trimming, dentistry, any abscesses in the foot. You can see that these donkeys have a very heavy workload, lots of sugar cane. You have to be careful with sugar cane because to feed this to animals, because it's got a high sugar content, and we're seeing quite a lot of laminitis at the moment in the clinic. But ACE Egypt has been set up to help horses, donkeys, cats, dogs. We are in outpatients with Joe. Hello, Joe. How important is it that you are here at ACE?
Oh no, very, very important. I'm very pleased I'm here. It's been a massive learning experience, learning loads from the vets. Really good to put into practice all those things that we learn through the Healing Animals organisation. A lot about, you know, just dealing with emotions, grounding. These animals are so intuitive, you know, it doesn't matter whether they're from Egypt or from England. You know, they're the same beasts, they read our signals the same way. You know, there is times where obviously there's tragedy, but, you know, we've been taught to keep ourselves calm, to deal with the situation, and use that energy really positively. It's really important to remain positive in such situations.
And how important has it been to learn some of the first aid skills while you're out here?
Yeah, fantastic. I mean, obviously having horses of my own, you know, the first aid is something that we do. It's fantastic to see the different types of cases that come in. You've got the road traffic accidents, some really nasty cuts and injuries, and how quickly and efficiently they deal with it. And to be able to assist these, the doctors and the vets that do such a good work here, it's been a privilege.
Would you like to come out here again to help with the Healing Animals organisation?
Yes, I'd love to.
Well, Kim, it's been such a pleasure to be working with you.
Thank you for all your help this week. It's been amazing.
This week, and we wish you the best of luck.
Thank you.
To continue the wonderful work that ACE is doing.